Okay, it's being recorded.
Thank you, Liz. So good morning. Welcome everyone to the CMHPSM FY 2025 Bidders Conference. This meeting is being recorded. You are welcome to turn your cameras off. Otherwise, it is likely that you will be recorded as well, so you don't need to have that. We are here to present to you today the funding opportunities that have been released. The requests for proposals are being presented today, not the request for quotes. So if you have any questions on any of these, on the request for proposals or the request for quotes, we'll talk about the process later, but you will be directed to submit questions to the contracts at CMHPSM.org email. You can look at the chat for a couple of messages on some technical assistance. If you need any technical assistance, you can use the chat for that, but please don't put questions in the chat. And we are here as a team to present this to you. So you're going to be meeting several people from the team. You don't have to listen to me the whole time. If you're just joining, please know the meeting is recorded. Please mute yourself. I've muted all participants already. I should be muted. You can turn your cameras off or else you'll be recorded with the recording. So feel free to turn your cameras off. So for today's conference, Bidders Conference schedule, we have started at 9:30, so welcome. And this is for all, this introduction section is for all RFPs A, B, and D. We are going to be talking about operations in about 10 minutes. We'll talk about the finance portion, and then I will talk more about the funding opportunity overview. We will have a scheduled break at least a few minutes before 10:20. If we may finish earlier. If we don't, we'll give you at least 1 minute for a break, and then we will start the strategic initiatives overview right at 10:20. You don't have to stay for the strategic initiatives portion. If you're not interested in applying for that opportunity, you're welcome to leave and come back for the prevention or prevention coalitions presentations at the times listed. They will start directly at those times listed. We will have the scheduled breaks in between depending on how much time is available. So feel free to stay the whole time, and also remember that it's recorded and will be available to you after the presentation is over. And we will commit to being finished by 12:30 at the latest. So that's the agenda for the day. And now I'm going to turn it over to CJ to talk about operations.
Good morning, everybody, and happy Friday. My name is CJ Witherow. I'm the Chief Operations Officer, as Nicole said. Just to give you a little context to my role regarding this process, I am the one who is managing the bid process in terms of launching the bid. So what got put up on BidNet, making sure we're, that was launched correctly. I'm also managing the questions. So when you send the questions, I'll be reviewing them, keeping track of them, making sure they get answered. And I'll be the one who'll be publishing those questions at the date they're being published. So, and I will I'll pause at the end of the presentation, or end of my part of the presentation, if folks have any questions. And the last thing I want to say that I almost forgot is for those who have a proposal that's been approved and goes through the board approval, I'm also the person who manages the contracts and will be sending the contracts out for the grants. All right, I'm officially ready now, Nicole.
Okay.
So if you're not familiar with our region, we are what is called the prepaid inpatient health plan. It is a Medicaid term, 42 or not 42, Code of Federal Regulations term. The state names us by region numbers. We are Region 6, which incorporates Lenawee, Livingston, Monroe, and Washtenaw counties. So we have a partnership with our CMHSPs, and we have a regional provider network that includes all behavioral health services, people with a mental illness, people with a developmental disability or cognitive impairment, and people with some type of substance use need. Probably the key component to that about the introduction with who we are is the grants and the proposals are specific to the region, our region, and service area. Services and grants would be occurring within our 4-county region. Anything else you want me to say about that, Nicole?
Nope, I think that's perfect. Thanks.
Okay, great. So you're going to be getting a lot of reminders about certain dates. The proposal submission deadline is May 3rd of this year at 5 p.m. And it is set at 5 p.m. Anything after 5 p.m. is considered a late proposal. So if the proposal is late, even at 5:01 p.m. on May 3rd, or if it's not in compliance, if it's not complete, it doesn't meet the requirements, which is a little segue into make sure you're reading all the instructions. The instructions might be a little bit different for each of the RFPs, but they won't be considered. And where to find information, we're keeping information on 2 areas. One is through BidNet Direct. If you don't have an account at with BidNet Direct, you can register for a free vendor account. It gives you access to bids. It gives you access to other bids as well, but it gives you access to our bids. There are some components of BidNet that are a fee, but the process to apply for our RFPs and some other bids is a free account. You just have to register and sign up. And then you'll also find information on our website. We'll be updating things on that website in the procurement page as things progress.
Ready for the next slide?
Yeah, I should probably say that. Next slide, please.
Thanks.
So in terms of programmatic questions, they are due by April 15th, also at 5 p.m. Any questions that you have to be directed to the email address that you see here, the contracts@cmhpsm.org. That's, as I said before, that's the email that I'm managing to make sure we're gathering all the questions, making sure we're answering them, make sure we have all the questions to publish them for everybody to see them when they're available. We are only answering procedural questions. They include things like issues or guidance related to obtaining the documents, any technical issues around access to the information, any questions you have about vendor registration on BidNet Direct, and any questions you might have about the electronic submission of your proposals to our agency. And I'll also note it is by email that we need those questions. If you call me, I won't be able to respond. I will defer you to please use the email and ask me the question via email. So the questions that we received by April 15th at 5 p.m., I know that's tax day too. Sorry if that's a busy day for you. But if anything that's we received by 5 p.m. on April 15th, we will be pulling together and posting all of those questions and answers both through BidNet Direct and our website on the procurement page. And I can go to the next slide, please. Okay. Just a few things to note, and these instructions are in each of the proposal documents or each of the grant documents, that all required fields must be emailed prior to the deadline to the same email address with the email subject line as it's titled here, the RFP number, for example, 2025D, your agency name and submission. It just helps us. There's a lot of emails that come to that contracts email box, so it's just making sure that they all are collected and we see them all. All required supplemental document files must be named as indicated in the main document. Each of the main documents has a table that identifies and describes to you how to name those document files. We cannot accept any kind of paper copies, faxed, mailed, anything like that. Everything needs to go through the email submission. You will receive a proof of receipt once we receive your proposal, and that will also come from the contracts email. So if you don't get one, check your spam or your junk files. Each file name must start with a corresponding file or requirement number. And this again is in the instructions. For example, the cover sheet submissions should be named number 1. Each file has a number named to it, a cover sheet, your agency name, and your program name. And lastly, it's recommended that you combine multiple documents into one PDF for the required financial requirements and or optional supplemental information. It's a better way to ensure that all the documents are submitted, so it doesn't become an incomplete submission. If it becomes an incomplete submission, we won't be able to review it. If you do choose to submit multiple documents for one submission requirement, please just make sure you have different names for each document so we can track them accurately. And next slide, please. Okay, so the proposals that are approved, just to give you an idea of the timeline, you will receive an email from Nicole as the Substance Use Services Director in August, once the proposal is preliminarily approved by our regional board. The final budget goes to the board in September of 2024. That's why that's called preliminary. So you'll get final confirmation after that regional board meeting in September of 2024, when the full budget is approved. And at that point, that's when contracts will start to be launched out as well. Proposals that are not approved, you will receive an email with that response as well. So you won't be left wondering what happened to your proposal at that point. And you'll receive those also from Nicole in August of 2024. I think that's my last slide. Is that my last slide, Nicole?
It is. Thank you very much, CJ. You wanted to pause for questions, though.
Yeah, I think that's a good idea. Any questions folks have about what I presented? I'm not looking at the chat, so let me look at the chat.
We did mention not to put questions in the chat, but about this,
I'm so sorry.
About this specific issue, this is specific to submission requirements. So questions not about the RFPs or RFQ themselves, but about what CJ was just talking about, you're welcome to add into the chat. Thanks.
All right. Well, thanks so much. Good to see you all.
Thank you, CJ. And I realized that I didn't introduce myself as CJ was talking. So for people who don't know me, I'm Nicole Edelman. I'm the Substance Use Services Director here at CMHPSM. And I will now turn it over to Matt Berg, who is our CFO. Thanks, Matt.
Hi, I'm Matt Berg. I'm the Chief Financial Officer at CMHPSM. And I'm here to kind of talk you through the finance part of the project. Almost all of these grants are funded by federal dollars, which means that we need to follow the federal guidelines on how to apply for a grant. And what I'm trying to do, at least in part in this presentation, is make sure that when you submit your grant, you're not accidentally running afoul of any federal guidelines. So if you'd move on to the next page, please. One of the first things we need to have is either your audited financials or 6 months of operating results. One of the things that we are required to do to give out federal dollars is make sure that the people who receive the dollars have an accounting system in place to track how the dollars are spent. This is just our way of making sure that you have a system in place that will be able to track the dollars. Next slide, please. There's 2 documents that you'll need to fill out as part of your grant application. One is the budget narrative and one is a budget dollar amount. What we did is structured the budget narrative so that it helps you think about the grant in a way that makes it easier to fill out the actual budget dollars. When you're looking at salary and wages, you want to just look at people who will be working directly on the program. I understand that it takes more than just the direct program people to make things work. We'll talk about how other people are handled later. So when you think about filling out this section for salaries and wages, this is just the people who are going to be working directly on the program. Yes, we do cover fringe benefits. What we're asking you to do here is just to write down the type of fringe benefits that you offer your employees, and that will then help you when we get to the actual budget and we're asking about your fringe benefit percentage. Next slide, please. When we're talking about travel, we're talking about local travel, driving your car. If you have some type of conference worked in later, the travel associated with that conference would go down in other expenses. Contracts. Again, these are contracts that are directly related to providing the services of the grant. I'm sure you'll have other grants or other contracts for IT service or maybe your internet, things like that. That's not what you put in here. This is just a contract that's required to complete the programmatic work of the grant. You could move on to the next slide, please. This is one that frequently is not as clear as it could be. When we say operating supplies and expenses, this means specifically the supplies you need to run the program. We're not talking about putting copy paper in your copier and using that. That's covered in another section. This is just what you need specifically to do the program of your grant. Other is just that. If there's something that isn't covered under the other categories that you think is needed for this grant, this is where you would want to put that in. If you wanted to do a program to advertise your grant, you would need to ask for those funds here. And then if you could move on to the next slide, please. Indirect costs. This is one that always causes trouble every year when we do grants. The federal programs allow you to charge 10% of all of the direct costs, all of the things that we've talked about previously in the narrative, in what's called an indirect cost rate of 10%. That is almost across the board. There was one exception a couple of years ago from MDHHS, but otherwise you can charge 10%. What this means is you don't need to calculate how much time your executive officers are going to spend on the grant, because it almost always comes out to less than 10%. So the federal government came up with this 10% rate as just an easy way to say, okay, we do want to cover your other costs of running the program, like what it costs to have a building available for your people to do the grant. And those are covered by this 10%. It's called de minimis indirect costs. If you could go on to the next slide, please. And now we're going to talk about the budget. And as I said, the narrative is there just to help you think about what the dollars are and how you're going to run the program. And then we need you to go in and do the specific budget. If you could go to the next page. Salaries and wages. Another area that sometimes gets confused is, what do we mean by an FTE, a full-time equivalent? The easiest way to think about it is that for every 40 hours per week that a person would put in, that would be one FTE. If you anticipate a person is only going to put in 20 hours per week, it isn't one person who works one full-time equivalent for your organization. It's one half person who's working half-time for this grant. They may spend the other half of their time doing something else. Next page, please. Fringe benefits. Although we want to know what fringe benefits you're offering your people, you don't need to track it month by month for exactly how much you pay for each person. What we're really looking for here is what percentage of your salaries is fringe benefits, and then you'll be able to charge that out to us each month without having to report the amount that you paid in health benefits and dental benefits and life insurance. That's a lot of work, and we really just want to see a percentage here. For travel, as we talked about earlier, this is just local travel. It's currently charged at 67 cents a mile. subcontracts. These are just subcontracts that you need specifically to run the grant. You'd go to the next page, please. Operating supplies and expenses. This really isn't pens and paper, as I mentioned earlier. This is just operating supplies, things that you would need for the grant. If you were going to give out identification cards or something like that, that would be an operating supply. Other, anything else I haven't talked about? If you would scroll to the next page, please. And this is where you would put in the 10% indirect costs. Yes, there are some larger organizations who feel that 10% is not enough, and they go through and they cost out their entire organization, and they'll come back and say, no, we think it should be 11%. If you want to do that, please go ahead and do that. But really the 10% is designed so that it can save you a lot of work, that you can get compensated for your rental costs, your utility costs, and not having to break that out just for the program costs. The total should calculate separately, and then we would fill in the total CMHPSM funding based on what we think would be an appropriate amount for the grant. As has been mentioned earlier, if you have any questions, please direct them to our email, and then we will answer anything we receive by the 15th. And I think that is the end of my, oh no, one more. Federal requirements. There are things you cannot put in and get funding from federal grants. Federal grants will not pay for alcohol. Don't include any alcohol in here. None of these grants will pay for any type of equipment. Equipment is defined as something that costs $5,000 or more. So if you want to get some equipment, this is not the grant to get it. There's also a limit on how much you can pay a person per year. You cannot allocate anybody's salary who gets paid more than $221,900 a year. I know some of you think that's high, but there are also some medical organizations who are applying for these grants who do pay some of their people that much, but they cannot be allocated to the grants. For federal grants, you wouldn't be able to pay for meals. That's just a requirement of the federal grant program. There is a much smaller grant program that I believe Nicole will talk about later, where you may be able to apply meals, but in general, just you would not get meals paid for from a federal grant. I think that's the end of my presentation. Yes, thank you.
Thank you so much, Matt. Okay, we're running just a couple of minutes ahead of schedule, so that's good. So I'm going to now talk a little bit about an overview of the funding opportunities that are available so that you are able to hear a little bit more about them. We do encourage you to read each one, the main document of each funding opportunity, to make sure you're applying for the right one. Of course, agencies may apply for multiple different programs under multiple different funding opportunities, but we want to make sure that you get your specific program into the right funding opportunity. And so I'm going to give you an overview of those, and then you will hear them in detail throughout the rest of the morning from my coworkers, from the rest of the team. RFP number 2025A is for substance use prevention programs. So this is specifically prevention programs that follow the strategic prevention framework, which many of you are familiar with. Some may not be, and there are resources that are made available to you that you'll hear about if you come to this session, and if you read the documents, also referred to as SPF. They do lead to evidence-based interventions being implemented that are absolutely data-driven. All of our programs, we need to be data-driven. And so it requires you to follow 5 steps of the process, all which must be followed, all in detail, which will be gone over in the prevention program section. Again, please read that program proposal document if you have any, if you want to look at more detail about that program. 2025B is Substance Use Prevention Coalitions. So this is specifically just for prevention coalitions. It has a lot of similar information for as the prevention programs does, but is specific to coalitions. So it is more at the community level change rather than the individual level. So there's still the strategic prevention framework that is followed very closely, along with CADCA's 7 strategies for community level change. And that is a document that will be provided to you as a resource in the future if you look at the document and if you come to that session, that part of the session today. Again, following the SPF process. And then we have strategic initiatives, which is actually where we're going to start our presentations. We're going a little bit out of order because we know that some people want to come to some and not to others. So we felt like strategic initiatives is a little bit more of a catch-all category that more people might be interested in attending. People, you are welcome to come to all of them and stay the entire morning. This strategic initiatives 2025B, this is a list of programs that have historically been funded. It is not limited to these programs, but this is in general the programs that are funded or have been funded. They include anchor institutions, which are projects that address populations with health disparities, primarily Black and African American communities and Latinx communities. Also collaboration with the justice system, engagement centers, peer support programs. I'm not going to read them all to you, but it's really important to see this one also that says addressing emerging substance use trends. So if you feel like you have a program that is not specifically fitting one of these, and also absolutely does not fit prevention or prevention coalitions, if it's an emerging substance use trend, you'll want to come to this presentation and hear more about strategic initiatives. And then the last part of this, we're going to talk about this morning, and you're going to get a break from me talking and hear some of my coworkers, but we are going to talk to you a little bit about the fund sources that are going to be used to support these programs that we are going to be able to invest in. And we are excited to invest in these programs. We'll talk a little about these fund sources. We are going to apply the fund sources to the programs as they are most appropriate. So the fund source will be selected for you by CMHPSM staff as it's most appropriate to the population or the program as we see fit. So you'll hear more about that in the next couple slides. You're going to hear about the different fund sources that are available, and you can read through them also in the proposal documents. So I am going to turn this over to Danielle and Alyssa.
Good morning. The purpose of the American Rescue Plan Act, or ARPA funding, is to increase efforts to address behavioral health conditions related to the COVID-19 pandemic. These efforts should prioritize young adults, health equity among identified underserved populations, and plans on how to address health disparities in prevention, intervention, treatment, and recovery support services. Evidence-based treatment and practices should be utilized for opioid use disorder, alcohol use disorder, and tobacco use disorder in combination with other substance use disorders. Next slide, please. PA2 funds are a portion of each county's state convention, facility development fund, and liquor tax revenue, and are required to be distributed for substance use services, prevention, intervention, and treatment programs within the county. This funding can be used for other opportunities that other funding sources can't be used for, such as food and/or syringe services. Next slide, please. Substance Use Block Grant Funding, or SABG, is used in treatment, intervention, and prevention programming related to substance use services. This is now being referred to by SAMHSA as Substance Use Block Grant, or SUBG. Funds can span the continuum of the Recovery-Oriented Systems of Care, or ROSC. All programs providing this funding opportunity must follow funding requirements. Not all funding opportunities shown in the SAMHSA and SUBG link are available to be funded in our region. I will now hand this over to my colleague, Alyssa.
Good morning, everyone. The purpose of the state opioid response funding is to address the opioid overdose crisis by providing resources to states to increase access to FDA-approved medications for the treatment of opioid use disorder and for supporting the continuum of prevention, harm reduction, treatment, and recovery support services for opioid use disorder and other concurrent substance use disorders, such as stimulant use disorder. Please note, fiscal year 25 SOAR funding is anticipated, but it has not been released yet by SAMHSA. All SOAR requirements listed on this slide, in the Strategic Initiatives RFP, or in the SOAR sample contract are subject to change.
Okay, so one thing I want to mention before we go to our scheduled break, thank you, Alyssa and Danielle. Some funded programs may receive multiple fund sources, so I know that can sometimes be confusing. We will work closely with you so you make sure you understand all requirements and what funds are received as allocated. So that's the conclusion of the beginning portion of our program. So any questions that you have, again, please submit them, as you can see in the chat, to contracts@cmhpsm.org. They will be compiled and posted. And we're going to take a break now until you can see 10:20. So we have about 20 minutes. The recording is going to stay on. So we're going to mute ourselves. We're going to keep our cameras off. And we are going to come back. You might want to come back about 2 minutes before, so you make sure you're able to catch everything. And we will start promptly with Strategic Initiatives presentation at 10:20. Thanks, everyone, for your attention, and we will see you shortly. I just realized I was muted. I win the prize for the day. So it's 10:20 and we're going to get started with the Strategic Initiatives RFP 2025D presentation. And I am going to do a beginning introduction of this initiative opportunity, and I'm going to be joined by my coworkers Danielle Brunk and Alyssa Tumalo, and together we'll present this initiative to you. And again, I encourage you, even though we are trying to explain this to the best of our ability so you'll understand it, we really encourage you to go into the documents and read them so you get the full understanding of what's included. So to start, this is really true of all of our programs, but we really wanted to highlight this in the Strategic Initiatives opportunity because it spans so many different types of programs. So we do follow a recovery-oriented systems of care model, or a ROSC model. You can look this up. This is just a picture of, or an example of, ROSC-oriented activities. So it spans the continuum of services from prevention to intervention to treatment to post-treatment. The source is down here at the bottom. It's from the SAMHSA.gov website, and it is a SAMHSA-supported model, and includes, as a focus of this initiative, mostly harm reduction, treatment, and recovery in the Region 6 counties. So the services that might be provided in this initiative could span this continuum. Also, what we wanted to focus on through strategic initiatives is that it, again, spans the continuum of services and types of programs that might be offered. So while the prevention opportunity focuses specifically on prevention and specific prevention, EBIs with a strategic planning framework or strategic prevention framework, and the coalition opportunity, this strategic initiative goes across the stages of change. So the approaches include harm reduction, treatment, and recovery along the continuum of care. There are resources to help you understand better the stages of change. There's a page at the end of this presentation, which we summarize all of the opportunities for resources that we provide to you. And there's also a resource down here at the bottom, smartrecovery.org, stages of change. So it goes through the cycle of pre-contemplation, contemplation, preparation, action, maintenance, and always, of course, potentially relapse. So also key to all of our funding opportunities is the fact that we really stress the importance of all of these funding opportunities to be data-driven. So it's important that you understand how substance use is impacting the community and the individuals that you are proposing to serve. And so there are lots of resources that are available to you. We didn't list them all here, or we didn't list them here for you, but we know there are a plethora of resources available that have data that we hope that you include in your proposal to make it stronger, to help us understand why it is you're choosing to serve the population you've chosen, why you've chosen the program you've chosen, and how the program is going to work. And these are just samples of types of data we expect you to be using and addressing. So our strategic plan, local epidemiological data, existing services and opportunities for collaboration. We really have a new focus on health disparities that we hope everybody addresses, and include social determinants of health that impact individuals across the region. And then again, I talked about this earlier, but we want to go into this a little bit into more detail so you oops, sorry about that. So we highlight the funding program categories in this funding opportunity. So again, anchor institutions, it's a SAMHSA title. We didn't name it that, but it's really for programs that work with populations that are experiencing health disparities and making sure they're able to be connected to substance use services, whether that be treatment or recovery or prevention or any type of service. Collaboration with justice systems, engagement centers, any harm reduction services, integrated care and treatment models that would be evidence-based, peer outreach and recovery services. I'm going to skip that one for a minute. Recovery support programs, recovery housing, youth outreach. And again, this is not an exhaustive list, and that's why I'm leaving emerging substance use trends as at the end, because if you have a program that you feel may not exactly fit within the title of these topics, that you can show in your data and your proposal is a trend that you are seeing in your local community that your program can effectively address with a specific population or a group of populations, that we encourage you to apply for that as well. And again, multiple proposals can be submitted by agencies. So if you have different programs addressing different topics, you are welcome to submit multiple proposals, but each proposal should be submitted for one program. And now I'm going to turn it over to Alyssa to talk about the requirements.
Hello again. As previously mentioned, each funding opportunity has specific submission requirements. The following slides are to highlight the submission requirements for RFP number 2025D Strategic Initiatives. Proposal documents and required submission items can be found on the table on page 10 of the Strategic Initiatives RFP main document. Please be sure to double check all required attachments and any supplemental document files, and make sure they are named as indicated in the instructions found on pages 8 through 10 in the Strategic Initiatives RFP main document. Next slide. Submission requirement number 1 is the completion of Appendix A, the cover sheet. Organizations must include Appendix A in their submission to have the proposal scored. Please complete and sign Appendix A cover sheet and include in your submission as a PDF document. Next slide. Submission requirement number 2 is the completion of the narrative program proposal found on pages 11 through 14 in the Strategic Initiatives main document. For this requirement, your organization should provide a detailed summary of your proposed program, including all aspects of the program that would be potentially funded by CMHPSM. All narrative proposals must follow the prescribed outline found in the main document, answering all questions, and be no longer than 10 pages. On the following slides, we will highlight some of the question categories found within the narrative proposal. Organizations should utilize a data-driven approach to respond to narrative questions. Responses should highlight local and statewide data, connect to CMHPSM strategic plan, which you'll find out about in a couple of slides, show collaboration with other programs or organizations for existing services, and demonstrate an understanding of gaps and disparities impacting individuals in the population of focus. Next slide. Question 10 on page 13 asks respondents to describe the goals and SMART objectives of the proposed program. The acronym SMART stands for specific, measurable, achievable, realistic, and time-phased. Goals and objectives should connect to the level of effort and funding that is being requested. On this slide, we have provided two objective examples. The non-SMART example is staff will be trained on the selected evidence-based model. The non-SMART objective example is not SMART because it is not specific, measurable, or time-bound. It can be made SMART by specifically indicating who is responsible for the training of staff, how many will be trained, who they are, and by when the trainings will be conducted. The SMART objective example is by Q2, April 2025 of the fiscal year, program manager will have trained 75% or 75 out of 100 of agency staff in the evidence-based models expert. For more information on how to write a SMART objective, please visit the resource link that we have provided below. It is also included in the RFP resources as an appendix. Next slide. Respondents should also review the Region 6 CMHPSM fiscal year 24 through fiscal year 26 Substance Use Services Strategic Plan and describe how your proposed program will align with the strategic plan. Proposed programs that are not aligned with the priority areas will need to utilize data to explain why funding should be considered for an alternative proposed priority within the region or local community. And there are the resource links for that again, also included as a reference. Submission requirement number 3, Appendix B, program budget. This was previously noted during the finance portion of our presentation. Please follow all instructions within the budget document and submit one budget per program funding request. I'm going to pass it over to my colleague, Danielle.
Thank you. Submission requirement number 4 is Appendix C. All organizations are required to complete a budget narrative. Please follow all instructions within the document and include the submission as a Microsoft Excel file. Next slide, please. Submission requirement number 5 is your organization financial information. These are required to be submitted in order for your proposal to be reviewed. Next slide, please. Your organization may consider submitting optional documents when completing this RFP, which may strengthen your proposal. Accepted supplemental information may include any relevant letters of commitment, involvement, or intention to partner and/or memorandums of understanding. Next slide, please. These following documents are provided as a reference to offer an opportunity for organizations to review what CMHPSM requires of all funded programs. I will now hand this over to our director, Nicole.
You got to pause from listening to me for just a minute. Thank you, Alyssa and Danielle. So these are some resources that are found in the narrative document. We just wanted to highlight them here for you so that you know they're in there. You don't have to worry about, taking a picture of the slide. Again, remember, this is recorded. This is going to be provided to you. And these are all in the narrative document on the website. And so this summary of the strategic initiatives presentation is briefer than you're going to see the prevention and prevention coalitions because it encompasses so many different programs. And so we understand that many agencies may apply for multiple programs within the strategic initiatives opportunity. So please, again, remember that every program you want to apply for should be its own proposal. It should have its own budget. It should have its own cover sheet. It should be separate for each program that you apply for. It could be in multiple categories. There could be multiple programs in one category. And if you have questions about that, please submit the questions to contracts@cmhpsm.org. and we will get answers to everyone so everyone can understand that. Again, they may be funded by multiple fund sources. In the past, we have done this by fund source as a funding opportunity, but we are going to match to the best of our ability your program to the fund source that most applies. And so I know that some of these breaks tend to be long, but what's going to happen next is we know you love being able to have breaks to check your emails and to keep your work going during the day. So we're not really taking 9:30 to 12:30 completely. We're giving you some time back, but in just a few minutes, in about 10 minutes, at 10:45. So if you want to log on really at about 10:30, or sorry, 10:43, we'll get started just welcoming you and making sure everybody's ready to hear the prevention programs presentation. That will be a bit longer and in more detail. And then the Prevention Coalition presentation at 11:35. So once again, you can pause. The recording will not pause, but you can turn off your cameras and your mic. Well, your cameras and your mics are off, but you can check your email, and we'll be back with you at about 10:43. Thanks, everybody. Welcome back, everyone. I hope everyone had an okay break and got what they needed. You have a good show coming ahead of you, so lots of information. I'm excited to introduce Jane George and Rebecca Dubois, who oversee our prevention programming, and they're going to take it from here and give you lots of great information on this funding opportunity. So Jane and Rebecca.
Thank you, Nicole. Yes, my name is Jane George. I am the Regional Prevention Coordinator, and I have to apologize. I've been just a tidbit under the weather lately, but I can't miss out on an opportunity to talk about prevention. So we're going to go through some slides. Rebecca, you want to mention yourself and at least introduce yourself before we rock and roll here?
Sure. Good morning, everybody. My name is Rebecca Dubois, and I'm one of the grants coordinators here at CMHPSM.
So first of all, on behalf of CMHPSM, I know I've been in prevention for as long as I can remember, and I just want to start off by thanking you. I was looking at the number, and I was hoping that we didn't have others jump off, and that there would be some other interest in these next two RFPs. So I do want to say thank you on behalf of CMHPSM. I also think that this is a really exciting time because it allows us and you to take a step back, really, and look at emerging trends, some of these things that we might want to address. It's a great opportunity to look at maybe some new prevention programs that might be out there that might address these emerging needs. I also wanted to mention that with the slides that you're going to see in the next half hour or so, while we could go into a lot of what I would say the weeds, we'll try not to do that. We really want to offer up kind of like more insight on the major modality of the strategic prevention framework, and then also ensure that you still go through the RFP in great detail. We're just not going to cover all those details. I also will say this, that I think in prior years, yes, we used to have a document with a variety of resource links on it. And then this year, what we try to do is, we really are looking for you to be successful and, have successful applications. And so we thought we would actually integrate some of these links at the actual point where we're asking for particular components of the proposal. I also will say this, that I don't know if folks even print things out anymore. I still do every now and then. If you have a printout, if you want to follow along, You know, CJ and the rest of the group here has talked about questions. And I know in previous bidders conferences, we've actually taken questions, and this year is different. So make sure you jot down questions along as we go. Because again, the bottom line is we want to make sure that you're knowledgeable of what we're looking for, and that we want to be as transparent as possible. So if anything comes up, jot it down and we'll make sure. I think, if I remember correctly, the due date on the questions is the 15th. And I'm sure somebody will tell me if that's wrong. Okay, perfect. Thank you for the thumbs up. Or if you have a split screen, even if you want to bring it up while we walk through these slides. Yeah, and I keep coming back to as well, even when I woke up this morning and I thought about this opportunity to be with not only my colleagues, but folks around the region in potential effective programming. What a great time to look at how can we, you know, really look at this information and help change people's lives, really. I kept coming back to that this morning of not only the individuals, but peers, communities, potential policies that will help individuals. And I could go off into left field, so I'll reel myself in. But I'm really excited about this opportunity. And, you know, one other thing I was thinking about is that we have a variety of people on here that already know a lot about strategic prevention framework. I'm just kind of going through the list right now, and I see some names that I'm just not familiar with. I don't know if Rebecca is as well. Feel free to jot the questions down, because for those that are really familiar with it, this will just be a revisit, and maybe, you know, you'll see something that you hadn't thought about in a while, or something that might intrigue you further that would lead you down a programmatic road. And then I just want to emphasize that, particularly when it comes to the concepts and the modalities, because prevention can be complex, but it also can be very user-friendly, and it can be very, very effective. That's the thing that we have in our field behind us. Okay, I will stop on my intro. Let's get going. Unless, Rebecca, you have anything to add?
No, I think you covered us. Thanks, Jane.
Okay.
Okay, ready for the next slide, Jane?
Please,
Okay.
please. Okay, so what you see in front of you, we have to have a jumping off spot, right? And so this is our jumping off spot. These are our priority areas for our region. As you can see, we're looking to reduce a variety of usage patterns, misuse, etc. Some are focused on younger or youth, reducing childhood underage drinking, obviously, reducing youth access to or use of tobacco and nicotine. And this is, again, I mean, we talk so much about vaping in the last however many years. That's where that would fall as well. Reducing the youth use of marijuana. This is something that's also surfacing more and more. We also have reducing prescription and over-the-counter drug misuse, as well as any other illicit drug use. And so while this kind of runs a gamut, it still kind of hones in, because what we're trying to do is utilize these priority areas, what I like to think of as umbrella. So all of the rest of your proposal and all of these elements should feed into at least one of these, if not more. And I know in the past, a variety of applicants have chosen more than one. Next slide. And how much time do I have on this, Nicole? I'm laughing because there's so much to be stated about this model. For those of you who are familiar.
I'll just tell you
yes.
quickly, just to keep you on time. So 11:35 is when we start Prevention Coalitions, and we'll have a little break before. So maybe just till 11:30.
Okay. All right.
Thank you.
And I was referring, I think of the SPIF as, again, a model that's so very effective. And when you start to look at this comprehensive model, you look at these steps. This particular depiction certainly goes through the steps: assess, capacity, plan, implement, evaluate. And as you see, this depiction has the arrows going one way, but those certainly could be going the other way as well, because this is circular. And while it provides a structure, it is something that you learn from one step to the next. Oops, do we have to go back and revisit this? So it continuously informs itself from one step to the next. And so when you start to look at assessing, we're going to go through a slide on that, or 2 or 3. We're going to talk about capacity. Rebecca will do that. We're going to talk about actual plan and how do we put this together and make sure it's something that not only is understandable on your end, but it's understandable on our end and the individuals that will be scoring your proposal. Implementing evidence-based programming. And Nicole started off earlier today. That's what this is all about. The good news is, and I say this all the time, our field is so gifted with lots and lots of research to show us that if some data elements leads us to a certain point, there's a lot of research out there that says, you know, if you do A, B, C, D, E, F, what should follow. Excuse me. And then my favorite, evaluation. And we will talk about several slides on that in and of itself. So again, these are the 5 steps, but obviously in the middle, we're having cultural competence and sustainability, 2 very, very key elements to this entire process. And I want you to make sure that within each step, you're considering both of these. The next slide, Nicole, because I believe that is, yes. The guide for the Strategic Prevention Framework. This is one a little bit more updated. This one's from June 2019. I've been doing this a long time, as I've already referred, but I'm telling you, I refer to this all the time. There are unique elements that I forget about, or unique elements that might surface when we're thinking about an outcome or a plan. And this will help us look at that in more detail. And so Rebecca and I thought it was important to make sure we link this into our slides. I think we linked it a couple times. And in particular, this one's noted as page 9. I also wanted to attend to, not only does it go into detail on each step, that's really, really important, but also it does have, I think it's toward the end, I don't have the page number at hand, but it has opportunities to integrate cultural competency into each step. And then it also talks about how the SPIF process really does inform and positions you for sustainability. And then it takes you through each of the 5 steps for both of those concepts. Next slide. So what are we going to do here? We're going to take the SPIF, as many of you are familiar with, and others not so much. We're going to take that and we're going to talk about, well, how do you use that to develop an implementation plan? And so when we talk about the narrative section, you're looking at on page 10, there are some questions. Again, we're not going to go through, not questions, there's topics. We won't go through every single one, but we certainly will address the modalities and some of the pieces that we're really looking for. So having said that, the title we give that basically, and some of you already are aware of this, is we call it an implementation and evaluation plan. Next slide. Yes, so let's dive a little bit deeper into assessment and capacity. I'll cover some assessment pieces and then I'll hand it over for Rebecca to do capacity or address capacity. Nicole, next. My favorite slide that many of you probably have already viewed this slide, I'm not sure. But if I was to cut through the chase on SPIF, what it really is, it's a comprehensive plan that is a data-driven process. And it really helps us let the data lead us. And over my years, we use the term data. I use it all the time. I often think of, let's make sure we understand data is basically people, what they're experiencing, what are their unique needs, what are some of the emerging needs, what are the disparities in specific populations. There's all kinds of pieces we could go into here. That picture of the data on the left there, I'm a numbers person, but I also understand the beauty of qualitative data, and that can be so informative. So just know that if there are elements that feed into what you're going to be proposing, make sure you identify that and add that to those particular pieces that are requested on that particular topic, wherever that might be. Having said that, the next image is really, truly, it's going to lead you. And it may lead you off to the left, and you might say, oops, no, we got to go back, because this might be an issue, but it might not be, the community might not be ready for it to address it, or we don't have enough partners in it. We need more partners, or what have you. So it might lead you in all different directions. So I just have to attend to this particular data element. Next slide, Nicole. Over the years, we really promote data as throughout this whole presentation this morning. And as Nicole, as my colleagues have addressed it, every data drives decisions, data drives dollars. I mean, here we are. We want to make sure that individuals that might not be, really into data or know where to find it, these are some potential resources. I've been involved with a statewide group, which we look at Michigan Substance Use Disorder Data Repository, which is, as many of you are familiar with this, it's kind of like your one-stop shop, although there's going to be other places you could find unique data elements. This one in particular does allow you to filter data, to go into the county level where you could hover over the state in your particular county. And then there's a wide variety of indicators. And you're looking at not only substance use patterns, you're looking at consequences, you're looking at risk and protective factors that are available there. The second one, I like this site because you can filter it in terms of particular surveys. So as many of you are aware, Michigan Profile for Healthy Youth. While some schools or districts you might not have data, you can still pull out or filter it to the latest year, and you can also then filter it out to your county. And I like that particular link as well. Michigan Traffic Crash, that's another one I often use. There's the NESDA. One thing that you will note in the proposal is that we would like you to drill down as much as you can. Sometimes we don't have data, right? But then drill down as far as you can. I would certainly like to see county data versus necessarily state or national. And if you can get zip code data, that's even better. Next slide. This is another slide that certainly, we could have all kinds of depictions and pictures and whatnot. But again, these are people's lives, right? So as we look at these dollars, how are we impacting people's lives? The questions that I've added on here, obviously, these are just a few, right? What is the primary problem? What particular substance? We're seeing and hearing about all different substances at this point, whether it's opioids, stimulants, vaping, the alcohol issue, all kinds. Trends, if you're able to look at trends, I think sometimes when you have descriptive data, it's one thing to have a stat. It's a whole other thing when you can see a trend with those statistics. Where are we headed or not? Are we going in the opposite direction of where we want to go? Ultimately, we want to look at consequences. So we don't want to just look at usage. We want to look at, well, what are the consequences of the use in our particular community? Demographics, this is very important. What populations? Where are the disparities? Where are the unique communities or spotlight communities that really need assistance or dollars put toward a particular program? Next slide. Intervening variables. Now, as you know, the strategic prevention framework, what I like to say with intervening variables is what I would consider digging deeper. So this is where we say go as deep as you can, right? We're also using the word modifiable risk and protective factors. I love that it says protective factors as well. This is not just about the glass half full and this is a risky thing going on or what have you, but what are some of the things that are really we know support kids not using or not getting in a car with a driver that's been drinking or familial issues or what have you, so that we're not only looking at what's causing the substance related problem or consequence, but what is increasing the likelihood for that or decreasing it. And I like this picture just because it kind of depicts a lot of thinking. You got to bring folks together on this and really look at this and where is the data leading us. And you're not going to be the end all to everything. We don't expect that. You're going to have to prioritize and look at what would actually be doable. I think the next slide is capacity, so I will hand it off to you,
Well,
Rebecca.
just a minute before we move on, I just want to highlight the Appendix B has examples of these risk and protective factors
Thank you,
related
Rebecca.
to particular consequences. So,
And I just want to say to Rebecca, why you bring that up, the appendix, this was some example, I think we got it out of Macomb County Office of Substance Abuse years ago. And I like this one in particular because it does give you those examples Rebecca's referring to with IVs, where there's a strong relationship with these IVs for those particular problem areas. And then in turn, it addresses some of the focus areas that we're focusing on, what I call those umbrella outcomes.
okay, so capacity is a significant factor for effective prevention programming. So based on the data analysis and the specific community that has been selected for the particular priority area or areas, then you'll want to assess what resources the community has, potential gaps in resources, and the community's readiness for addressing the prevention needs. Next slide. Also related is community partners. So this is where we're considering who is at the table or who's not at the table that should be. So with your proposal, you'll want to identify partners in addressing the prevention plan and indicate the role of each within the collaboration. We're interested in knowing how the program involves the community in the process for each priority. So letters of commitment, MOUs, memorandums of understanding, letters of involvement, those all can be submitted to support this, and the letters can indicate, the partner's level of commitment into this plan. So also consider community partners that are currently absent in your plan and who would strengthen the plan. And think of strategies that have been identified to secure their involvement in and commitment to this program in the future. Next slide. So next we'll go right into SPIF steps 3 and 4, which is planning and implementation. And this is where we're thinking through what works to address our prevention needs and how to do it, and then actually delivering the programs and the strategies. Next slide. So in your proposal, you'll identify the evidence-based intervention that has been selected that will impact the prioritized issue or consequence and underlying factors, which is the risk and protective factors or intervening variables, as Jane noted, and in turn, the prioritized consequence. And then also that it's the EBI that's appropriate to the target populations, and importantly, that it's evidence-based. So for the proposed EBI, we want to know a brief description of the proposed EBI and citation of the source that supports the evidence base. So in other words, how do we know that it's evidence-based? We want to know the sectors or domains that will be addressed via this program. For example, is it focusing on individual, peer, family, community, school maybe? The essential components to be implemented and the proposed timeline. So core features for delivery, like intensity, duration, setting, method of implementation, and importantly, describe how these components maintain fidelity to the model, because if we're using an evidence-based model, we want to ensure fidelity to ensure that we get the same results as the evidence shows. Also a brief description of the curriculum, materials that will be used when implementing the EBI, and staff training requirements and the current status within your organization on these requirements. Noted here, you can see on RFP page 12, there is a link of resources related to evidence-based programs. This, of course, is not end-all be-all, but these three are resources that Jane and I thought were particularly useful of, lists that list EBIs related, when you're trying to identify an EBI for your own prevention needs. Anything more on that, Jane, that I'm missing?
The only thing I might add is the idea of over the years when we consult with agencies, and there are adaptations, because remember, especially with cultural competence, there might be some unique pieces that, wow, this is a really, really good program. And through research, it shows that this is a great program. However, there might be some adaptations or something you're learning that doesn't fit into your community or whatnot. And the comeback for that is we always talk about, I would never have the answer around that, is to reach out to the developer. And so when you go into these resource links, you're able to filter, by the way. And again, different areas and where you want to, ultimately address particular populations. But also, if it does lead you to an EBI and you want to adapt, then I would suggest contacting the developer that is noted within the site. And then if there is anything that you want to state in your proposal around that might be unique from some of the data that is showing, make sure you state that in there.
Thank you, Jane. Excellent note. And with that, I think we can go to the next slide, which lists our CSAP strategies, which are included on Appendix C with a little more detail. But the CSAP strategies are information dissemination, education, alternatives, problem identification and referral, community-based process, and environmental. So we also want to hear in your proposal which CSAP prevention strategies are selected. And the most important note here is to ensure the use of multiple strategies that are consistent with the selected EBI. And from there, we're headed into Jane's favorite part, evaluation. So I'll hand it back to our expert evaluator.
I don't know if I'd call myself that, but hey, I'll take
would.
that. I'll take that compliment. Yes, evaluation, the SPIF step 5. And quite frankly, all these steps, again, are so integrated with each other that, when you're looking at evaluation, you're looking at it throughout the entire process. It's not just step 5. So we're looking at that throughout the process. The next slide, I think we're going now into the objectives and outcomes, because how can we evaluate without having specific outcomes? So Nicole, you can go ahead and hit the button there. There's my favorite picture again, where again, you need to go back and think about this, really think about it. And I think that my colleagues earlier also mentioned you're looking at the level of effort. I think we noted that, as well as the funding amount. If you're asking for 100,000 or just hypothetical, does that match up with not only where your data is leading you to, but what is it that you're trying to change in the first place? So what is it you're telling us as potential funders that what we would be buying? What are you trying to change? And so when we think of the SMART objectives in which Alyssa had alluded to earlier, the specific, measurable, achievable, realistic, and time-based. I can't say enough about the specificity, because it's going to make your life a lot easier the more specific you are, because it leads right into enhancing the ability to measure it if it's specific. One thing I will note, I like to see numbers versus a percent of population, although if that works best for you in terms of however you set this up and what population or community you're working on, I think it's nice to see how many you might be, not only like a baseline, how many might be participating in a program, but also how many might maybe participate in 10 or more sessions, and then what changes as a result of it. So if you can go deeper with that, there are examples as well on the writing smart, they call them objectives. I like to call, say, outcomes. Writing smart objectives, I believe that was CDC evaluation
And-
briefs. Yeah,
And a
and
link
it's an
to that
updated
is on
one.
page 13 of the RFP, sorry.
Thank you. Thanks, Rebecca. And so that will help you tease out a little bit more what that might look like. I also want to, in the past, when we talk about outcome development, we think about, and when I consult, well, I don't know how many numbers. I really don't know where to go and how many we should offer up. And I like the old term that we used to use, the doable with a stretch, so that you still have something you're working toward, something that might not be, you know, a small amount where, hey, in that first week we're done, you know, that's something that you really think, wow, wouldn't it be great if through all of our efforts in these dollars, our participants change in this way? And the only one that would have that answer is you and your team, because you are the experts in your chosen area, in your respective entities, and also with your respective knowledge of the data, your knowledge of the community, the knowledge of the specific program. So again, this, I think, takes time to think through. I do think that we do put a lot of weight on this because ultimately all of what you're doing, we want to have some change occur. And I know I start off the presentation with, how are we changing people's lives? How are we having an impact? And I know there's a lot of gurus in our region, and I think if we make up some strong outcomes, that will be really beneficial to you and us as potential funders. I'll also say this, when we talk about consult on smart outcomes, it's hard to say how many. I can't even, you know, we don't know. That would be ultimately something we would consider in terms of the amount of money you're requesting as well, and how does that fit together. So make sure that you really take some time to think through these. I also want to attend to, at some point, the evaluation part of this. So you could go to the next slide if you don't mind, Nicole. So along with outcomes, often I think, and yes, in our RFP, I had to think for a minute. Our RFP, we do ask for an evaluation tool along with your outcome. So while SMART specifies how to write one, we also want you to say, yeah, we're going to use surveys and do the best you can. We know this is a short period between now and ultimately submitting, especially if you're walking down the road of a new EBI. But I would say this, that you should identify at least how you plan to verify whether that outcome did or did not happen, or et cetera. It could be questionnaires. A typical, very, very typical outcomes: knowledge, attitude, skills. But again, as you can be concrete, you're going to be much better off in terms of being able to measure it. Validity and reliability, I mean, these are givens. I will say this, you know, we all know validity is the accuracy, right, of the measurement. Reliability is the consistency of the measurement. And quite frankly, this is where I come back to the developer of a program. Let's say you have a survey that's way too long, or it's not, it doesn't really attend to your culture or a population or the age, or I mean, fill in the blank, right? Then I would say that you here again should make sure you connect with the developer if you do adapt a tool, or if you plan to adapt a tool from a particular EBI. Other questions to consider. Added these. Will the program evaluation measure the result to your targeted SMART outcome? And you might say, well, you know, that's not a question, but it really is. And it hones in on over the years where I'll see an outcome, but it's not necessarily going back to what it is you're trying to change in the first place. So is it consistent with the domain? Is it an individual-based outcome, parental, familial, community? Here we have environmental. How do we know? Do we need to enact certain policies, and when would those take place or be implemented, or et cetera? Is your evaluation tool consistent? Here's your reliability, as well as with the condition. So, oh, here we go. There's the knowledge, attitudinal, and behavioral. that are very, very typical outcomes that you see with particular EBI programs. Hey, I kept it short. That's pretty good on my end, I have to say. Next slide, please. Okay, yes, you did see this before. And yes, there is a reason why this is at toward the end. Because ultimately we started off, not I, with these umbrella outcomes of what we would like to see changing in our community and all what we just said. And when you read the RFP in great detail, you're going to read it thoroughly this weekend, I'm sure, it's going to all feed into, in some way, shape, or form, one or more of these. And so that's why we hone in on this. You're looking at these other longer term outcomes. And Rebecca, if you don't mind, if you could, unless did I miss anything on your end that you think of that I should?
I think that covers it.
Okay. All right. And then you can go into the requirements. Thank you.
All right. So, excuse me, as you can see in the table here, these are the submission requirements for RFP 2025A prevention programs. You'll need to, in your submission, include a cover sheet, the narrative program proposal, the program budget narrative, organizational financial information that Matt spoke on earlier, and also the partner involvement, and that's those letters of support, commitment, the memorandums of understanding. And so it's important that all of these components are submitted with your proposal.
I think that concludes it, does it not, Rebecca?
Yep. I think that's it for us. So, well, for prevention program.
For now. And we did it in the allotted time. We get an award for that.
You do get an award. So nicely done. Thank you so much. That was great information. So again, we strongly encourage you to read the document that's posted to make sure this fits the program that you're proposing. Make sure you're able to do all that's involved with it, all the requirements, and it's spelled out very clearly in the document. And so nicely done. Thank you very much, Jane and Rebecca. It was great information. And we're going to take a break now until 11:35. So why don't that's a little bit more time for you to check your email, take a break, get some coffee. If you, hopefully we're keeping you entertained. But hop back on around 11:33 and we'll get ready to do our Prevention Coalition, which will be the last presentation. And then we will definitely be done before or by 12:30. Thanks all. Okay, it's 11:35. We will respect everyone's time and get started right on time. So welcome to the next scheduled portion of our presentation, the last one, which is about prevention coalitions. I'll just state one more time if you didn't hear me before. You do not have to listen to this part if you are not interested at all in applying for the coalition opportunity. You are welcome to, and again, it will be posted. But with no further ado, we look forward to hearing more again about prevention coalitions. Back to Jane and Rebecca.
Thanks, Nicole. Appreciate it. It's surprising to see this many people, which is great if you are interested in potentially looking at funds for a prevention coalition. Again, my name is Jane George, Regional Prevention Coordinator. Rebecca?
And I'm Rebecca Dubois, Grants Coordinator.
I think a couple things to state. Again, since we have folks that look at this recording at another later date this month or what have you, that we will be repeating a lot of what we said. There might be some nuances here. And I think the biggest nuance will be, let's now take the strategic prevention framework, and we can go to the next slide. On this particular slide are the prevention priority areas that, once again, these are going to be utilized for coalitions. And when we think about coalitions, this is coming at it from another whole different strategy, because a coalition, again, just to get us all on the same page, is not necessarily providing specific hands-on programming. There might be some, there might be, conducting a youth summit or what have you. But for the most part, we're looking at how potentially a coalition can look at their data in reference to how ultimately they might be changing these within their community. And I think I want to say from the get-go as well is, if we're looking at this through a coalition lens, every single step that as we proceed through this slideshow, Rebecca and I will attend to those elements, because I think when you're looking at a coalition framework, you're looking at a lot of other work in terms of bringing the right folks to the table and really having a buy-in from communities on these issues. So once again, we're looking at a reduction in these our focus areas for our 4-county region, reducing the childhood underage drinking and the access to and use of tobacco, nicotine, vaping. The other major one that we have worked tediously over, or I shouldn't say we have funded a lot of programs that have worked tediously over the years on prescription and over-the-counter drug misuse, and safe disposal, things along that line. Reducing youth use of marijuana. I've talked to a variety of individuals over the last few years and what that might look like now with the particular laws and whatnot. And when you start to think of illicit drug use, I think of throughout the career, and you think of coalitions of really being the staple in a community or a county, however we're going to define it, that might be the go-to when there is an emerging issue. And I think of, particularly when you think of a reducing illicit drug use, there might be some other substance that's a controlled substance, that's an illegal substance that might be emerging, that is starting to surface, and we know about a few already. But again, anything that we do from here on out with the slides, we'll try to go through each step through a coalition lens. Next slide, please. Yes, and here is the strategic prevention framework, the 5-step process, which is the comprehensive approach. I think when we start to look at a coalition lens, there are times when you're really looking at who's at the table with the coalition to assess needs. So not only are you trying to dig up data, and we're going to get into that, but also how are you analyzing it as a group? Because it could mean one thing for one, it could be another for another, but also with a capacity level, you're looking at political will within your community. You're looking at readiness, which Rebecca will clearly speak to later in terms of the sectors that we would like to see within the community domains, and who should be at the table, or at least try to get individuals at the table. But also, I think, when you look at assessing and you look at capacity with the community and you start to plan, I think it does add a whole other element, because you're bringing a group of people together. And I have seen in my career lots of really outstanding coalition work. I've learned a lot about coalition work across the state and nationally, and how impactful coalition work can truly be. Ultimately implementing that. Now, in this case, you see evidence-based prevention programs. Well, let's switch that up. Actually, I wish I would have already prior to this presentation, and said CADCA strategies are what we call those community level strategies. And I won't get into the weeds with those at this point, because Rebecca will attend to some of those. I also will say this, consistent with my previous Rebecca, and when we talked about in our previous slideshow, which is similar, obviously, is the idea that integrated again are those unique elements for links, resources throughout the RFP. Evaluating, now this is where I think when I say community coalition lens, this is going to be somewhat different. And as you know, there's a lot of gurus on this call. And so as we all know, you know, how are we evaluating a coalition's efforts? How do we know if you're making a difference? How do you know if you're making a difference? When can you celebrate your successes? Or when are you really needed in your community? And you know, the newspaper is coming and asking you your opinion, and how are we tackling this? And you have schools or whatnot coming to the table. I think when it comes to this, we're going to have to look more closely at community level outcomes versus more immediate program outcomes. And I will get to that a little bit later. Anything else, Rebecca, you want to say there?
Not that I can think of, Jane.
Okay. Nicole, if you don't mind, the next slide. Okay, and again, the guide, and certainly this can, you know, we think of strategic prevention framework overlapping for agencies and direct EBI individual-based programming, community-level programming, environmental-based programming, you name it, you can utilize this framework. And as I had attended to earlier, I often look at that to help guide these decisions. And in particular, if it's a coalition, you might want to share this document. You might want to get their feedback. If you haven't already, I don't know exactly who's all on here and how positioned you are within your communities. And I think that's another insight we clearly should identify from the get-go. And I think we have this in yellow at one point, and I don't know the page, I apologize, about if you're coming at this particular RFP and you're applying, you might be at all different stages right now with this SPIF model. So having said that, I think this guidebook is very helpful because you might be knee deep in you might have data from last year or something or whatever, I don't know. And you really want to hone in now more toward strategies or how do we know what to put in place. So again, long and the short of it is, you utilize the guidebook as much as you want and share it with, you know, the community or coalitions or whatnot. And the other part of this is I think it's very efficient document. And I think it also simplifies it in a way that I think everybody can understand the concept, understand the comprehensive nature of it. Next slide. Okay, difference here. Using SPIF to develop a coalition strategic prevention plan, not an EBI implementation and evaluation plan. This is completely on the coalition strategic plan. And so when we start to dive into this, next slide, please. Assessment and capacity. We're going to start looking at that. And I think you can go ahead and refer to that next slide I was talking about, my favorite slide of all, let the data lead you. I have it on my refrigerator. No, I'm kidding. But clearly at all levels with a coalition, right? Especially when you get buy-in, or let's say you want to get individuals where you know there's an issue in the community. Who do you bring to the table? And then I don't want to say sell them on the issue, but have some concrete evidence of this is what we're seeing. These are the MIPs. These are the traffic crash deaths, you know, et cetera, fill in the blank. Again, being a numbers person, keeping in mind qualitative is very impactful. You may have key interviews with what they call key informant interviews. You may have focus groups that you've conducted in the past. You may have anecdotal. So I don't want to discount some of that qualitative information that you look at the quantitative. Again, we're going to go to the next slide because this slide, it's going to point you in the right direction. And I probably should have had on that last slide a bunch of people on that arrow, not just the one person, because it's going to have to be the entire coalition moving forward on that. Excuse me. Again, these data, I'm sorry, Nicole, sorry. These data points, potential, every day I think I know something and I learn a new thing, a new site, a new EBI, a new strategy, a new data indicator, a new filter option. And again, I think we have some savvy individuals throughout our region that know how to utilize these and find data, but for those that are really at a loss of where do we even begin, let's say you're just starting a coalition and you think, oh my goodness, or we have a coalition, but we don't know how to move forward. These are some examples found on page 11. Next slide, please.
And Jane,
Oh.
before we move on, you noted this the last go around, but I think it's important to note again that the data analysis should consider gaps in services and health disparities experienced by underserved and historically under-resourced populations in the region, and then using that data to move your plan, implementing it into the plan.
Thank you, Rebecca.
Or integrating, excuse me.
You
That's
got it.
the word.
We'll get there, right? Between the two of us. Yeah. The cultural competence and sustainability. Thank you. Very, very key points. And again, you can seek out more detailed information in that particular document. Same slide. We could put all kinds of pictures here. We could look at all kinds of substances, what have you. And when you're coming at this again from a coalition level, I think you have to look at buy-in, you have to look at prioritization, you have to look at level of support you're going to get within the community. What is that primary problem? Why is there a coalition in my community, and what is it that we need to do? What is the primary problem? What are the consequences that we clearly see in our community? Or when I say community, it could be county. And that's why we're not defining that for you, because I think that's where you would define it when you apply for these funds. Demographics, which is huge. Each county is so different. We have various elements that might be unearthed that we're not aware of a particular issue. And this is where, when you have key informants and you have coalition members from all facets or various facets within the community, that's going to bring a whole new knowledge level to your table that you may not have. And again, I know there are folks on this call that are gurus in this. I think I just wanted to emphasize that too once again. Next slide, please. At a coalition level, yes, I think that this discussion, it's just, let's put more people at this table, or maybe not, and we have 10 different tables and we have small groups. I don't know whatever it takes to get to the point of really, we have this community or county and we want to dig deeper and say, what is causing it? What's causing this problem? We're going to dig deeper. We're going to learn from various facets within the community or sectors, from businesses, from the faith community, from schools, from health facilities, what might be some of the underlying issues. And again, I talk about this a lot, not just the risk factors, but what are some of the elements that are really good in our community that are really, really helpful to decrease the possibility of a problem or a consequence that is SUD or SUS, sorry, Nicole, related. Next slide, please. Yep, there we go. I forgot about it. I was waiting for Rebecca then to join in. Yes, again, examples, and they do come at it from so many different avenues with this particular document that I think it's a useful piece. Any of these informative pieces, I think if you can share with your team or your chair and your coalition, immediate group, see how it fits into your mission and values, any of this information. But again, to integrate any of these concepts or documents with your team or should I say coalition. Next slide. And I'll hand it off to my colleague, Rebecca.
Okay. Thanks, Jane. So capacity, as we've mentioned, is a significant factor for implementation. So based on your data analysis and the specific county or community that has been selected and your priority areas, then you'll assess what the resources the community has, the potential gaps in resources, and the community's readiness for addressing those prevention needs. And then, next slide, please. Jane has really highlighted this throughout because, after all, we're speaking on coalitions. And so, Jane, I'm sure that I might miss some great points here. So please jump in if I'm if I'm missing anything. But again, who is at the table? So we want to know what coalition members are present in your coalition and their associated roles. Included in RFP 2025B is a 12 community sector checklist, which is Appendix C. So that's one of the submission requirements where it allows you to specify from all of the 12 community sectors who, what sectors are present within your coalition and specifically who is filling those seats essentially. So, excuse me. And again, letters of commitment and involvement and memorandums of understanding should be provided from community partners, and it should list the role of each, which those should detail the role of each really. And then also who isn't at our table and who would strengthen the response to our priority problems, and then strategies of how to get the people missing to be a part of our programming or strategies in the future. What am I missing, Jane? Anything?
I think that was well done. Thank you.
Okay. So from here, we'll go into planning and implementation, steps 3 and 4. And so this is where we're thinking through what works to address our prevention needs and how to do it, and then actually implementing those strategies. So next slide, please. For the coalition strategic planning, we are looking at the CADCA strategies, which we'll list on the next slide, but we want to ensure that we're selecting strategies that will impact the prioritized intervening variable or risk or protective factor, and in turn the prioritized consequences identified, and also that are appropriate to the target population. And it is expected that a coalition's plan will include an applicable assortment of the 7 strategies for the community level change. So we would expect that a coalition wouldn't just be looking at one strategy, but multiple that are applicable to their community. And also resources, a resource is linked on page 12 of the RFP, which gives a little more detail about the CADCA strategies. And then on the next slide, we have the CADCA strategies listed, which are provide information, enhance skills, provide support, enhance access or reduce barriers, change consequences, change physical design, and modify or change policies. And again, these are linked on page 12 of the RFP. Anything further on CADCA strategies, Jane?
Yeah, and I think with some of the resources, they give examples too within each one of these strategies. And, sometimes one goes with the other, or you can't do one without the other, or et cetera, et cetera. And I think, if we're just providing information, we're certainly going to want to see more than that. And that's where the applicable assortment. But again, this comes back to also that the team, the coalition, the buy-in, and ultimately the whole plan, because you might have a strategy that you would really like to implement, maybe even as a coalition chair, but there might not be, the level of effort might not be available, or there might be, not just staff, but also the funds might not be available, or the will in the community to make a change. Because one of the things you look at with these strategies, as Rebecca addressed, and then earlier, the idea of, how ready is the community to make a change? The slide that talked about resources and readiness cannot be emphasized enough at a coalition level, right? So when you think about bringing a variety of brains to the table, or a lot of different buy-ins, and what might be important to some, and how do you get us all together, and then you look at preparedness and how prepared is the community to not only implement a strategy, but to actually tackle some of that data element that led you there in the first place.
Thank you, Jane. And we'll move on to the next slide, which takes us to evaluation.
Right. And again, this is where obviously we're going to have a little bit different viewpoint here coalition lens. Let's say it again, because you can do the next slide too, Nicole, if you don't mind. Certainly you may say, well, we're not necessarily providing a program. You may have a plan that identifies a program, and you may have, where you're seeking out someone to actually implement based on your coalition's comprehensive plan or what you would like, where you'd like to head. But also I know that there are times when we do have some more immediate outcomes that we could potentially measure. And I don't want you to lose the ability to show that success, because again, outcomes isn't just let's write an outcome, as we all know, but it's also to, really highlight your efforts. It's also to define in the community. And my other piece with this is that then you're able to also say, see, we're making an impact here. And we had this youth summit, and this is what was the result of a youth summit. I'm just hypothetical. I'm just throwing something out there. Or you're having a particular event that you're really bringing the community together on that. And are there some more immediate outcomes there? And I think that there are. And this is where I think that there are efforts that are made, changes that are happening that we might not always capture in on paper, in language. And I think that that's important, because it also not only helps you to celebrate your successes, but it also is nice to promote your own efforts via that. And again, I say this, I know there's individuals on here that are gurus, so I probably could advance this information way further than I could, because I'm not heavily involved in a coalition at this moment. All I know is, coming from the standpoint I know, and I've had input from a variety of across the state, learning on that of those particular elements with more immediate outcomes. Again, if that's the case, specificity. And that leads right into that second one, because then you're able to measure it with a specification. The achievable, is it something that is achievable? Maybe you're coming up with an outcome that, well, we're not getting enough funds for that. There's no way we could do that with this amount of funds, or there's no way we can do it with the players at the table because we're running into a community block or something. I mean, I don't know. I'm just thinking of different elements that could happen here. Or is it really realistic? Is it something like, in the best of all the worlds, it'd be great if you could have this particular change occur as a result of a particular strategy, but would that be realistic? And certainly time phase. Anything you have in terms of an outcome, if nothing else, it helps you to track and manage your own outcomes when we have the time phased element of that. Next slide, please.
I just want to interject here that that the CDC resource is also linked in this RFP on page 13.
Thank you, Rebecca. Same questions as earlier. If we take a look at this from a coalition standpoint, you might have some of the county reports on data, or you might have some other elements that we could look at in terms of community level outcomes. Now, one thing I will say around this, measuring progress and success, it's difficult to often say, because the coalition did this, this is what's occurring. That can be very hard to know. I often land on, can you at least speak to how you're contributing to some of these? So when you're measuring more of these larger outcomes, and what I would say community level, you're starting to get into maybe some of the larger indicators, like you want to reduce MIPs in your county or whatnot. There's all kinds of examples, but what I'm trying to get at here is that then you could track that, certainly, and you can see how your coalition had efforts that might feed into that. But it's not put upon you to say, because you're going to do this, this is going to change. So I think all of us, I just want to acknowledge that from the CMHPSM standpoint as well. And I'm not sure, Rebecca, if you have anything else to share on that, but I feel very strongly about that in reference to at least speak to how you could potentially contribute to a community level outcome. Tools consistent with domains, and in this case, it might be some, let's say your coalition says they want to implement new policies on XYZ, or you know, what have you. How would that ultimately be measured? Not only is it developed, but did it come to fruition? Is it in place? Are people utilizing it? Is it impactful? All kinds of pieces. Environmental, I mean, that's another one that I think coalitions often get into versus the more immediate individual. You're looking at the bigger picture. You're looking at population-based changes. The tool consistent with the expected change, and in this case, I think this is much more, these examples are very individualized. I think when you start to get to the knowledge level, although you may have a training for individuals in the community on XYZ issue, you could clearly specify a knowledge change on that, or a follow-up, maybe a pre and a post or something along that line. But again, understanding that you may not have a local or a agency evaluator, full-time evaluator. However, we do want you to be able to measure your successes. I think it's really, really important. And if it's not a success, to learn from it. And if it's not a success, you're learning from it, and then you're making course corrections along with your team and your coalition. Next slide. I can't remember if this was the end. Okay. Yep. Just like the other one, let's feed into this. Whatever the coalition is doing, even if it's some of those immediate outcomes with the immediate efforts based on those CADCA strategies or their community level outcomes, to really think about impacting one or more of these. So all your efforts leading into one or more of these priority areas for CMHPSM area, 4-county area. I think that would be it. And Rebecca, you can talk about summary submission.
Just a quick summary of required submission items for RFP 2025B Prevention Coalitions. Ensure you include a cover sheet, your narrative program proposal, which is what we mostly discussed today, and then your Coalition 12 Community Sector Checklist, which is Appendix C, the program budget, program narrative, and budget narrative, and excuse me, the organizational financial information. And again, another submission for partner involvement. So that's your letters of support, memorandums of understanding, letters of commitment from partners involved with the coalitions. So just make sure that all of these items are included with your submission. And I think that concludes this one. Thank you all for being here to learn about the coalition RFP. And I think Nicole is summing us up for the afternoon.
I did it again. Thank you very much. I will sum us up, and I won't do it for 25 minutes, so you will not have to be here till 12:30. So we're giving you some time back in your day. Thank you, Rebecca and Jane, so much for both of those presentations. Thanks to Alyssa and Danielle for presenting on strategic initiatives. Appreciate CJ on her operations presentation and Matt for your finance presentation. We couldn't do this without the whole team. Thanks to Liz for helping everybody on the side in the chat and letting people in. And thanks to our CEO, James Kalani, who's here and supports our programs and everything we do. And we want to thank you all for being here and for all the work you do and for seeking funding to continue it and to expand it and to really help the people who need it the most. And we look forward to any questions you might have. Again, please send them to CJ popped on maybe to remind us to, nope, just to say hi, to send your questions. They will go to CJ to contracts@cmhpsm.org. And they will be posted as you saw in the chat. So they'll be posted on the 19th we're trying to cross post everything on BidNet and our website. This recording will be available. Our goal is by the end of the day today. So that should be happening. So if you want to review any part of it, you should be able to. Anybody else have anything to say before I close the meeting?
I just want to add a big thank you as well for the attendance. We really appreciate it. Really, very much so.
Absolutely. Thanks, everyone. Have a great rest of your Friday and good luck with everything, and we look forward to seeing what you have to turn into us. So thank you. Take care.